Making healthy lifestyle choices is always important for good health. The sooner you begin making the change, the longer the compounding effect you are going to have on all areas of your health. For people living with silicosis or silica-related diseases, this is even more important. I want to share some crucial lifestyle adjustments that can help you improve your health and well-being if you are living with silica-related diseases. These changes can significantly impact how you manage a condition and enhance the quality of life. First and foremost, if you smoke or vape, quitting is the most impactful step you can take. Smoking or vaping introduces harmful substances in your lungs, increasing the risk of infections and worsening the lung damage. This not only speeds up the progression of silicosis, but also leads to more severe symptoms and a faster decline in lung function. Contrary to some beliefs, vaping is not a safe alternative to smoking. It still poses risks to your lungs. Harmful chemicals enter your lungs, potentially can worsen your condition. It can also increase the risk of serious health issues like lung cancer, chronic bronchitis, and other serious conditions. The benefits of quitting are immediate. Within days, your lung function begins to improve, and over time, you'll experience less coughing and breathlessness. You will also lower your risk of complications and infections. If quitting on your own is challenging, there are resources to help. Contact the Quit line for support from specialized counselors. Find online resources and speak to people who share your journey and understand your struggles. Talk to your GP about nicotine replacement therapies and other medications to manage cravings and withdrawal symptoms. Regular exercise is vital for improving your physical fitness, stamina, and overall health. It also helps reduce breathlessness, increases tolerance for daily activities, and combats fatigue. Start with low-impact activities such as walking, swimming, or cycling. These exercises are great for your heart and lungs and help you use your oxygen more efficiently. Aim for at least 30 minutes of gentle cardio exercise most days of the week. Begin with shorter sessions and gradually increase as your stamina improves. Exercise using light weights or resistance bands helps maintain muscle mass, including muscles used for breathing. Strength training twice a week can counteract muscle loss and reduce overall fatigue. Flexibility exercises like stretching, yoga, or Tai Chi are also beneficial. They improve flexibility, balance, and range of joint movement, making daily activities easier. Aim to include these exercises a few times a week. Always warm up before exercises and cool down afterward to prevent injury and reduce stress on your heart and lungs. Consider exercising with a buddy, personal trainer, or a family member to develop a habit and maintain the discipline of exercising. If you are new to exercise or have significant symptoms, consider working with a physiotherapist to develop a tailored exercise plan. Attending a pulmonary rehab program can also provide personalized support using supervised aerobic, strength, and flexibility exercises. You will be seen by a team of professionals who are experts trained to best care for you. Vaccinations are crucial for protecting your lung health. They help prevent illnesses and infections that could severely impact your condition. This is especially important if you're on immunosuppressants or have other health problems such as blood disorders. Ensure you're up to date with essential vaccines. Some of these vaccines are the flu shot. The annual flu shot is essential to protect against influenza, which can cause severe respiratory problems. The RSV vaccine. This vaccine protects against common respiratory viruses that can be serious for those with chronic lung conditions. Pneumococcal vaccine. This vaccine helps protect against pneumococcal infections that can lead to pneumonia and other severe illnesses. COVID-19 vaccines. Ensure you are fully vaccinated and receive the booster shots as recommended. TB and DPT vaccines. Check if your tuberculosis and diphtheria, tetanus and pertussis vaccinations are up to date. Avoiding infections also means wearing masks and avoiding people who are sick or coughing. A healthy diet supports your immune system and helps you maintain a healthy weight. Focus on balanced diet. Eat a variety of nutrient-dense foods including fruits, vegetables, lean proteins, whole grains, and healthy fats. High-protein diet. To counteract muscle bulk loss from repeated infections with silicosis, increase your intake of lean proteins such as fish, poultry, eggs, beans, legumes. High-protein shakes can also be beneficial. Fill in half your plate with fruit and vegetables to get vital vitamins and antioxidants. Healthy fats include sources like fish, nuts, seeds, avocado, and olive oil to support heart health and reduce inflammation. Drink plenty of water to keep mucus thin and easier to clear. Consider herbal teas or broth as additional hydrating fluids. Monitor caffeine intake, as excessive amounts can exacerbate symptoms. Alcohol in moderation should be managed carefully, as it can dehydrate the body and interfere with medications. If you're struggling with your weight, work with a healthcare provider to develop a plan that suits your needs, whether you're underweight or overweight. Avoiding environmental irritants. Minimize exposure to environment pollutants or irritants that can aggravate your lung condition. Here are some tips. Avoid exposure to smoke and dust that can irritate your lungs. Stay away from smoke, dust, and chemical fumes, especially if you have asthma, allergies, or hay fever. Limit time in high pollution areas such as busy roads or industrial sites, and monitor local air quality. In times of higher pollution, consider closing windows or using an air filter inside if you have one. Usually, pets are not a problem for people with silica-related diseases. However, some people have allergies, may find that cat or dog hair or exposure to birds can cause lung problems. Make your home environment safe. Use air purifiers, avoid harsh cleaning chemicals, and ensure good ventilation. Use masks and follow safety instructions when handling chemicals like paints. Make sure the area is well ventilated and take breaks outside for fresh air. By implementing these lifestyle changes, quitting smoking, staying active, maintaining a balanced diet, ensuring vaccinations are up to date, and avoiding irritants, you can manage your symptoms and protect your lung health. Making these adjustments is about taking control of your health and improving your quality of life. Consult your healthcare provider for personalized advice and support.